what we want to look at in every hospital we inspect is it safe? Is it delivering effective care? Is it caring in terms of the way patients are looked after? Is it responding to patients' needs? And then fifthly, is it well led? We will be looking at a large range of different sources of information. Some of it is data that we can get from different surveys or from different measurements that are publicly available. Some we will get from asking the Trust direct questions and looking at the board papers or whatever it may be. Some we will get through other organisations, our partner agencies, Health Watch, the Monitor, the Trust Development Authority, the local CCG. All of those will have information to give us about a trust. And then importantly, it's what we see and hear when we go on our site visits. And that includes not only directly observing what's happening in different departments of the hospital, but also talking to staff, talking to management, talking to the patients and the public, all of those things to make sure that we're hearing all angles on what's going on in this particular trust. We are charged with giving an overall rating for a hospital as a whole, but on top of that, or to get to that, we really feel it's important to take a bottom-up approach. In other words, to look at some core services like the accident and emergency services, like the medical services, the surgical services, the critical care, maternity, paediatrics, those sorts of services, to look at them and to rate each one of those. And in fact, to rate each one of those against our core questions. Is it safe? Is it effective? Is it caring? Is it responsive? Is it well led? So we will attempt to measure each of our services on those 5 different questions. What that will do is enable us to get all of those ratings together and to assess overall whether we think the trust is safe, effective, caring, etc., and then get to a single overall rating. And those ratings will be on a 4-point scale. Is it outstanding? Is it good? Does it require improvement, or is it inadequate? I hope and believe that people will have confidence in the ratings that we're developing. I think they'll have confidence because they will know that it's based on all of these different sources of information, and also confidence because they will know that a knowledgeable team of people has been into the hospital. Now, that knowledgeable team will include doctors and nurses and patients and carers and managers and CQC inspectors, all working together, all looking at different parts of the hospital, but all coming back and saying, how do we rate this overall? So I think that the importance is we're not relying on any one thing, but we are looking both at data and at what we see on the ground.